effective approach to use with people when basic talk therapy is not working as successfully as one would like is an approach called Dialectical Behavior Therapy, which is short for DBT. What that is a behavioristic approach to teaching life skills to help someone manage their life accordingly. So DBT was formed by somebody named Marsha Linehan, and she has a very interesting background. She herself, at the age of 18, was put in a mental health facility and was deemed not curable. They thought that she was going to be there for the remainder of her life. She struggled with numerous disadvantages that she speaks about in her biography. She was self-harming, she had anxiety, and she had depression, and she had suicide ideation, which means that she had thoughts of suicide. And a couple of times she did attempt to take her life and was obviously unsuccessful, thankfully, because she was able to form DBT. She is also a strong Christian. She's actually Catholic. She talks about her faith. And that was a very important part of her journey and creating DBT. She also flew over to Asia and participated in some meditation to come up with DBT. DBT is a 4-module series that is taught basically as a class. Interestingly enough, when she went to get it approved by the board as an approved mode of treatment, they said, this is not normal. Like, this is not talk therapy. And she said, exactly. They said, this is like a class. And she said, exactly. Because that is what DBT is. It is teaching. It is the therapist teaching the client the skills that are needed to navigate. So those 4 modules that I just referred to are mindfulness, which is the number 1 important thing because mindfulness is woven throughout the other 3 modules. The second one is distress tolerance, and that's when you are extremely agitated. So if you imagine yourself on a scale of 1 to 10, 1 being I'm totally chill, and 10 being I'm about to karate chop someone's head off, or I'm about to have a nervous breakdown. If you are above a 5, she would say that you're in distress. And no matter what you're trying to do, you're not hearing things and you're not able to learn. So those distress tolerance skills will help you lower your number to at least a 5 so then you can manage. The third module is called emotion regulation, and that is exactly what it sounds like. It's helping you have the skills to regulate your emotions so you can stay in that 5 and below category. And then the last one is interpersonal effectiveness and communication. And that is how we communicate with our environment and the people around it and the messages that we tell ourselves internally. That definitely, all 4 of those together worked to give you that overall umbrella of mental health wellness that will help you achieve your goals. The normal cycle for DBT is about 6 months. That's if you do it in a group setting. Here at Spanish River, instead of a formal classroom setting, I do individual DBT with people. And the advantage of that is that my clients, maybe they only need about 4 months because we can breeze through topics that are not applicable to them, or we can spend a little bit longer and hover on a particular topic or module that is important. I've had people go from 4 months to 8 months. And then what's normal in the DBT cycle is to take a little break after that and then come back and then do the whole cycle a second time.